Mr. Mirjana Zivanov. Very good.
Thank you. Dear colleagues, my name is Dr. Mirjana Zivanov. I'm from Serbia. I'm practicing homeopathy for about 20 years. And first I would like to thank the organizers and to Dr. Shakti Mohan Sharma and to say how happy I am to be here with you today. Now I will present you some new aspects of my work with patients. So, in the beginning, we should ask ourselves, what are incurable diseases? Every disease is a state created by the situation the patient is in, combined with genetic and karmic factors. Today, I would like to present you the new methodology we have gradually introduced to our practice last 3 years. It has shown great results, so I will be happy to share an overview of it with you today. In my practice, we are focused on first giving a patient his sole remedy similimum to improve his health in general, his level of energy by making his vital force stronger. We follow our patients for years by follow-ups, usually once a month, and we have noticed that after some time on similimum, new things are opening up. Those things are not covered by similimum because they're not coming out from the soul of the patient, but from his physical level of existence, his family, ancestors, and situations. All those remedies that are coming after the similimum we call karmic remedies. When the first karmic remedy opens up after similimum, we say that the patient enters his karmic labyrinth. Karmic themes are often associated with the family members, some friends, or some situations from the patient's childhood. During the conversation, we'll come to the whole story about that symptom. We'll ask the patient, when was the first time that symptom appeared? Almost always the patient will remember that. And then we'll ask him what was happening to him at that time. And that is how we come to the traumatic event on energy level. It is usually something like a death of a family member, a breakup with a girlfriend or a boyfriend, or some injury. Trauma on energy level makes a physical symptom that in time will just get worse and worse.
So wonderful.
While the patient describes that situation, we observe which words he uses and which of those words he uses with the highest emotional charge. That words he uses with the highest emotional charge will then lead us to the karmic remedy. We stay on that karmic remedy for some time until the theme is solved. When we get to the point when there are no more emotional charges of those themes and stories, we can say that the theme is solved by that karmic remedy. After some time, the next theme will open up, triggered by some situation in the patient's life on the path to his karmic labyrinth, so we have to start looking for the next karmic remedy. Sometimes that happens very fast and we go to the next remedy. Step by step from one karmic remedy to the next, we are going through that labyrinth, and in time, if patients keep on working with us, we come to the next high level, like in a video game. Now I will present some incurable cases, very interesting cases, and how they were solved. The patient came in very poor condition. The diagnosis was bone metastasis. She came to us where even opioid patches couldn't relieve the pain for more than a half an hour. Kadota knew me and knowing that I'm a homeopath, so she brought her mother to us, hoping that we could reduce her pain. They had already accepted that the illness was incurable and that the end was near. The patient described how the illness started. It started in 2006. She was diagnosed with a carcinoma of the large intestine. At that time, she was operated and the carcinoma and the part of the large intestine were removed. Then she received chemotherapy. Just a year later, she was diagnosed with liver metastasis and she again received chemotherapy. 4 years later, the cancer has spread to the bones and the tumor-like lesions were visible on her X-rays, and then that is the time when she came to us. The detailed description of the case taking and the first 3 years of follow-ups in this fascinating case was published in the Homeopathic journal Homeopathy for Everyone 10 years ago. So, therefore, we will not go into details here, but give you an overview of the case. The patient has a robust bone structure, which has become more prominent since she has lost a lot of weight due to her illness. Despite being gravely ill, she was a strong-willed and energetic person, a woman of action. When she decided to pursue homeopathic treatment, she tried to cheer up everyone in the room after telling the story about her illness. When she sat down, her posture was quite peculiar, leaning to the right side of the chair, the position I have often seen in patients whose simillimum is pterygium. From the case taking, we can see a restless and energetic person, disciplined, ready to fight for her objectives, feels like she's imprisoned in her apartment, likes to be on the move all the time, dedicated to work and very precise, relaxed by knitting, feels better in warm and dry weather, constipation since a young age, and likes oranges. Through the entire case taking, the team was present to make, not to make, which according to the matrix method corresponds to the code of the remedy Pterygium curasavicum. For example, she likes knitting not to calm down, but to make a scarf, or in another example, to make a house. After case taking, she was prescribed her simillimum Pterygium curasavicum 230, and the next day after the remedy, her daughter told us that she felt much better, she had more energy, she was in a better mood, and she got out of her bed all by herself. She got hungry and ate quite. That didn't happen for years. Patient stopped using fentanyl patches. Fentanyl is the synthetic opioid analgesic, which is approximately 100 times more potent than morphine, as well as Neurontin and Ranten and benzodiazepine, because it wasn't helping her anymore. Next days during the night, she suffered severe pain and hallucination. Opium C30 was prescribed as her first Karmic remedy for the abstinence crisis because she stopped using opioid patches. During the following week, the pain was almost completely gone, her stool and her appetite improved. She was in a better mood, had more energy, and her daughter noted that her voice was strong again, just like before. She only still couldn't sleep at night. She was very restless and nervous at night, so at that time, we repeated her simillimum in a higher potency, Sim 200. After taking this remedy, her sleep improved, and she became less nervous. After a period of time on simillimum, the Karmic Labyrinth opened up again after opium, her first Karmic remedy. Here we came across the main causes of her incurable illness, being a refugee, running for her life, being injured in a car crash. Each of these situations lead to the next Karmic remedy in her Karmic Labyrinth. So her Karmic remedies for opium, Arnica montana, stramonium, Mercurius corrosivus, and Bellis perennis. Opium, shock from war and car accident, obstipation. Arnica montana, emotional trauma from war and physical trauma from the car crash. As we already said in the slide 4, trauma on energy level in time makes a physical symptom. Stramonium, feeling of terror from war. Mercurius corrosivus, from being humiliated as a refugee and urinary infections. Bellis perennis, consequences from the car accident and the theme guilty, innocent, that many refugees have. That is also the code of the remedy Bellis perennis according to the matrix method. After 3 years of homeopathic treatment at our clinic, she improved so much that she was able to travel alone to Dalmatia by bus, a 10-hour journey. At this point, the article was published. Now, 10 more years have passed, and she comes to our clinic only once or twice a year for some minor health issues. Now it is 18 years since the illness started and 14 years of the beginning of the homeopathic therapy. So we can see how operation and chemotherapies just suppressed the illness to deeper and deeper levels to the bone cancer and incurable state. The simillimum raised the patient's vital force. During the homeopathic therapy, we walked together through her karmic labyrinth, and with help of several karmic remedies, we restored her health. This demonstrates how, with good homeopathic treatment, even the most severe incurable illness can become curable. Now I will present you a very short overview of a few more interesting incurable cases from my practice. Another incurable case was a 35-year-old woman with strong headaches. She was diagnosed with brain tumor. After the case taking, we prescribed Labyrinth C200. The night after the remedy, she started vomiting, and she kept vomiting 7 times more until the next day in the afternoon. She didn't take any allopathic drugs, as we told her. After that, she felt great, had more energy, and she was in a great mood. When she went on a repeated NMR brain scan, just 1 month after our remedy, there was no tumor at all, and allopathic doctors were in shock. Another incurable case was a 70-year-old woman with spasmic paralysis of the right side of her body that lasted for days. The condition was going on for years, and she has been to many neurological examinations in several hospitals, but she wasn't getting any better. Then she came to us, to our clinic, and after we took her case, we found her simillimum casticum C200. Immediately after the remedy, she got better, and she was under our supervision next 7 years, and symptoms didn't return. Just a few times she felt some mouth spasms, like the symptoms could come back, but we would just repeat her simillimum, and the symptoms were gone again. Another incurable case was a 28-year-old woman with strong vertigo, nausea, headache, especially in PMS. She was eating everything from the fridge when she woke up at night, and she was mostly sitting in the corner. She was diagnosed with brain tumor, and after the case taking, we prescribed her muriatic acid C200. After the remedy, she said that she wasn't sitting in the corner anymore, and the night eating stopped. The vertigo, nausea, and headaches stopped in PMS first, and then it stopped altogether. She started running and lost her weight. When she went on a repeated NMR brain scan, there was no tumor at all. All these examples demonstrate how with good homeopathic treatment, even the most severe incurable illness can become curable. With every karmic remedy, the patient gets stronger and the sky above his head clears up. People will work with us on their karmic labyrinth and karmic issues as long as they want to. They may stop on some level and come back to us if they want. Some of them feel strong enough to work on their karmic issues by themselves. But if some bigger problem appears, they may come back to us to help them with our karmic remedies to solve their problems in an easy and right way for the better future. Thank you for your attention. I hope this was useful for you. More about the matrix method, karmic remedies, karmic labyrinth, you can read in my books published by Mirjana. Thank you.
Thank you very much. Now I will request our patron and my most favorite, Dr. Mirjana Zivanov.